So the today's session is not a bhashan. It is what I have gathered over the years for other residents and what mistakes I did during my residency, which would have, if I would have avoided, which would have made my residency easy. Okay. So that experience is what I'm going to share with you guys today. Okay. So I'll take all your doubts, all your residency related doubts at the end of the session. And it's a very short session. So we will just see what I have to share with you and then you can ask your doubts from me. Okay. So the most important thing is that when we take radiology, we have absolutely no idea that what is radiology, and the first 6 months of radiology residency are the toughest because all you see is gray and white, which you have never seen during your during your MBBS. You have never been to the radiology department, or you have had a short posting. You have taken radiology just because you secured a very good rank, and it is one of the top branches. And indeed, it is one of the best branches available, but you really begin as a very clueless resident and you are dependent on your seniors, others in the department, other colleagues for guidance. So 10 years back when we did our residency, we didn't have YouTube and we didn't have mentors who would guide us. We just depended on our seniors. Whatever they told us, we tried to do that. We used to discuss with other residents, but because of the YouTube and the digital era, you have a lot more exposure than we had, right? So the first 6 months of residency you just spend in acclimatizing to the environment and to radiology. And I would like to first clear 5 common myths about radiology, right? So let's start. The first myth is, which keeps you sad throughout your 3 years, is that your environment matters the most. By environment, I mean if you take up DNB, you feel that the MD is learning more than I am learning. If you are doing diploma, you feel the MD and DNBs are learning more than I know. If you are working in a peripheral hospital, you feel that the ones who are doing residency in the tertiary centers know more. And once you do it in a government setup, you feel the ones in the private setups, they have recent advances more than anyone else, right? And if you do from a private setup, you feel the government people are doing the ultrasound more. So it any single institute, let it be PGI, AIMS, won't be complete, right? You are learning and the learning will go on lifelong. So what matters most is you rather than your degree. You do diploma, then you can do secondary DNB. It's okay. You are doing MD in a peripheral hospital, you learn ultrasound and CT, and you can learn MRI gradually during senior residency. That's okay. You are DNB, you are doing DNB, you have a difficult exam pattern. That's okay. So whatever, wherever you get the seat, wherever you are planted, just try to gather the maximum from that place and don't feel that my environment is not helping me grow. So जहां हो वहां का maximum सीख लो, जब आगे जाओगे वहां से और सीख लेना, right? So don't torture yourself that I could not get into MD radiology, I am doing DNB, I am in a periphery. So all these things matter, but they don't matter the most. What matters most is how you go through your residency and how much effort you are putting, right? The second is that we take up radiology thinking that radiology is a very chill branch. We have worked hard, we have got a very good rank, and now we have come to radiology and we are going to have a chill life. No, that is totally a myth. Radiology residency is as tough as any other residency. First, because radiology is a vast branch and it is growing at a faster pace than any other branch. Second, you need to know head to toe anatomy, you need to know the pathologies, you need to know the pathophysiology, you need to know the imaging, that also on X-ray, CT, MR, ultrasound, and now PET also. And then you should know the clinical management also, because the clinician is going to call you and ask you and discuss you about management, right? Apart from this, you have radiophysics. So you have no idea. All my 11th, 12th went in this fear that how I'm going to pass my physics. And when finally I landed into radiology, I was astonished that still again, after 5 years of MBBS, when I had left my physics behind, again, I have to read physics, and that also a tough one. So you, apart from all this SIAPA, there is one more thing called radiophysics that you have to learn during your residency. And also, radiology may x-ray darkroom, the teachers, the examiners who are old, they are going to ask you about all the conventional things which are not even done now. And the teachers or the consultants who are a little young, they are going to ask you about all the recent advances. So it is a evolving branch, but the elderly will keep asking about the dark room and the procedures, and the young consultants will keep flaunting and asking about the recent advances. So you need to know a lot. That's why you need to read a lot. That's why you need to work a lot hard, right? Then is radiology is a non-clinical branch. No, it depends on you. Radiology is very as much clinical as you want it to be. You need to know about every specialty. You need to deal with every clinician. Once you are into practice, the clinician is going to ask you and discuss with you कि क्या करना है, एंटीबायोटिक दे दूं या एटीटी चला दूं, है ना? पेशेंट के सारी हिस्ट्री, उसके सारे पैथोलॉजी के रिकॉर्ड्स सब आपको चेक करने हैं, क्योंकि आपको एक क्लिनिको रेडियोलॉजिस्ट बनना है, तभी आप क्लिनिशियन की क्वेरीज को आंसर कर पाएंगे, राइट? सो रेडियोलॉजी इज अ very clinical branch and you need to know about all the specialties. तो इसलिए the more clinically you are oriented, the better radiologist you would be. So it's a total clinical branch. Think like clinicians, don't think like technicians जो scan खींच देते हैं but उसके आगे उनको कुछ नहीं पता. You are radiologist and you are a part of the team who decides कि management क्या करना है. Patient has stone with pyelonephritis. Do we need to go for surgery or we can still wait कि stone अपने आप निकल जाएगा? ठीक है. So you are a radio clinical radiologist. Don't think it's non-clinical, and you can just do your reporting and not look at the history of the patient, not look at the reports of the patient, the lab parameters, everything you have to correlate yourself and not leave at the clinician to be correlated clinically. So it's a very clinical branch. Then the fourth myth is that online learning is better than your books. Neither your online learning, neither your nor your books can give you that knowledge which your department will teach you. So working in your department teaches you far more than reading books alone or doing some online learning. So you see, you read whatever you see in the department, then and whatever you read, you have to see. So आपको जो आप पढ़ रहे हो उसको जब तक देखोगे नहीं तब तक याद नहीं रहेगा, और जो आपने देख लिया है एक बारी उसको जब पढ़ोगे तो और अच्छा समझ में आएगा. देखने के लिए डिपार्टमेंट जरूरी है, समझने के लिए डिपार्टमेंट जरूरी है. सिर्फ ऑनलाइन लर्निंग या बुक से बात नहीं बनती. When you see a case, when you report the case yourself, then you will learn. When you do a ultrasound yourself, then you will learn. आप ऑनलाइन अल्ट्रासाउंड की जितनी मर्जी फेलोशिप्स कर लीजिए, until and unless you know how to do an ultrasound, you will not be able to pick up the findings. So your department matters. Working in your department will give you a lot of passive learning, though you need to come and read whatever you saw in the department, but you have to be attentive in your department, and there is no replacement to the department work you do. Okay. The fifth is that we have a very hectic residency and it is very toxic because it is very hectic. No, hectic is not toxic. Hectic, if it is hectic, you have a lot of workload, it is giving you an opportunity to learn. The exposure, the more exposure you get during your residency is going to teach you more. See, the 3 years of residency is the only time when someone else is responsible for you legally. The moment you are a senior resident, the moment you pass radiology, it's an end branch and you start practicing and you will be responsible for your actions. So these are the 3 years. The more you see, the more you learn, it is going to help you. So don't feel that, because it is hectic at our institute, it is toxic. Yes, the environment becomes toxic because of the people around us. So in case your seniors have been very daunting, they have been making you do a lot of work and it is not a teamwork that you are doing, you be the change, you break the class, you be the one who's nice to your junior and you work as a team. The department interdepartmental relations will decide what toxicity is. The patient load is always good. The more work is always good. And irrespective of jitna bhi hectic ho, radiology mein you will always get time to party, to enjoy. We used to have 8 to 8 at our institute, and then we used to have a class from 8 to 10 in the night, and still we used to manage to go to see movies after 10, to have friends to at our place, to do party with them. सो रेडियोलॉजी में पार्टी का स्कोप हमेशा हो जाता है, बट अगर हेक्टिक है तो उसको टॉक्सिक मत समझो. जो टॉक्सिक एनवायरनमेंट है, जो टॉक्सिक पीपल हैं, आप वो चेंज बनो, सो दैट यू नो योर जूनियर्स से कि हाँ हमारे सीनियर्स बहुत अच्छे थे, वी वर अ टीम एंड वी वर्क टुगेदर. जब आपके एग्जाम्स हैं, दे विल हेल्प यू, व्हेन दे नीड हेल्प यू हेल्प देम. सो इट इज अ वर्किंग टुगेदर डिपार्टमेंट एथिक्स which will decide कि टॉक्सिक है कि नहीं है. Right. So once we are done with these myths, now we come to your 3 years of residency explained into one slide. So now what should be the roadmap for your 3 years of residency? You know, so the first year is the foundation year, the second year is the consolidation year, and the third year is for your exam preparation and building your confidence into an independent radiologist. So first year में क्या क्या करना है? First year में the first 6 months you have to acclimatize to radiology. What do I mean by that? अभी तक आप anatomy पढ़ते थे, radiology में it is radio anatomy. Okay, so radiological anatomy is different from what anatomy we have been reading. When you see the CTs and MRs and a lot of gray and black and white in your ultrasounds, you will get confused कि ये हो क्या रहा है, कुछ दिख ही नहीं रहा, कुछ समझ ही नहीं रहा. So for 6 months give time to acclimatize to radiology, क्योंकि वो radiological anatomy समझने में time लगता है. ठीक है. Then the first year you should try to do the basic ultrasounds, abdomen, chest, fetal, ब्रेस्ट अगर आ रहा है तो बेसिक अल्ट्रासाउंड सीखने की कोशिश करो, अपनी ड्यूटीज पे अपने सेकंड थर्ड ईयर्स के साथ करने की कोशिश करो. एक्सरे में स्टार्ट रिपोर्टिंग एक्सरेज and even your conventional procedures. Try doing those things with your seniors, and by the end of first year you should be able to report all your x-rays and do all the conventional procedures, right? Physics. The most important thing is to start your physics as early as possible. X-ray and USG physics should be completed by the end of first year. There is no second thought about it. The earlier you start, the better it is for you. Mind you, physics first day से भी start कर सकते हैं. When I joined radiology, I was given ultrasound physics topic on the first very day to be presented after 1 week. And I was so unhappy with that, that I thought that I should leave radiology. But now, retrospectively, I realize it's good that we started it in the first day or the first year itself, and we could complete the X-ray ultrasound physics in the first year. तो physics अपना first year से ही शुरू करना है. Start with the basics of your thesis, make your thesis protocol, start understanding. If you have some topic like MR perfusion, MR spectro, or something which is very advanced, then try to start acclimatizing yourself to that recent advance so that you are able to learn it quickly and gather your cases by second year. अगर मुश्किल टॉपिक है तो समझने में करने में टाइम लगेगा. इफ यू टेक अ लॉट ऑफ टाइम अंडरस्टैंडिंग की है क्या मोडालिटी, केस इकट्ठा करने में आपको टाइम लगेगा, एंड देन मेकिंग एंड कंप्लीटिंग योर थीसिस माइट बी एन इशू. So if you have chosen, if you or your guide has chosen a topic which is difficult, then make sure that you put in extra effort, क्योंकि आपको केसेस इकट्ठे करने में टाइम लग सकता है. Start reading your basic systems. Chest, GIT, basics of neuro, MSK, GUT. जो basics हैं, MSK में bone tumors, bone lesions पढ़ना है, chest में mediastinal masses पढ़ना है, chest x-rays report करते हो सारी pathologies पढ़नी है, basics of neuro पढ़ना है. तो radio physics, basics of ultrasound and your basics of system हमने पढ़ना शुरू करना है, right? Observe the reporting in your CT MRI posting. Perform the CT MRI scans if it is a trend in your इंस्टीट्यूट. खुद करोगे तो बहुत अच्छा रहेगा, बिकॉज एग्जाम में पूछते हैं कि कैसे करेंगे स्कैन. सो इफ यू डू इट योरसेल्फ, इट विल बी एन एडवांटेज टू यू. कंसोल पे बिठा देते हैं अ लॉट ऑफ फर्स्ट ईयर स्क्रिप्ट की हम तो बस स्कैन कर रहे हैं, फिल्म बना रहे हैं। आप पैसिवली लर्न कर रहे हैं कि स्कैन कैसे करना है, आप पैसिवली लर्न कर रहे हैं कि आपने फिल्म कैसे बनाई, आपको ये काम आएगा। सो डोंट वरी कि आपसे ये सब काम फर्स्ट ईयर में कराए जा रहे हैं, दे विल हेल्प यू। You can still passively see the senior resident who is reporting by your side. Once you are filming, he will tell you the findings. So you are still passively learning कि ये findings थी मैंने डाली हैं. तो passive learning department में हो रही है आपकी, right? If you get a chance, do basic CT head, MR head रिपोर्टिंग। सो कई इंस्टीट्यूट्स में CT MR पोस्टिंग ज्यादा लगती हैं, तो अगर आपको चांस मिल रहा है, डू स्टार्ट रिपोर्टिंग योर CT MRI, जितना भी होता है करना शुरू करें। फर्स्ट ईयर में रात को थोड़ा सा टाइम निकालें टू सी द स्पॉटर्स। व्हेन यू सी द स्पॉटर्स और यू रीड द ऑस्की, आपको बहुत सारी चीजें एट अ ग्लांस पैसिवली दिखने लगती हैं और समझ आने लगती हैं, एंड यू माइट बी सीइंग दोस केसेस इन योर डिपार्टमेंट आल्सो। सो कीप सम टाइम कि थोड़ा मेरे को हर रोज क्वार्टर रिवाइज कर लेना है, थोड़ा सा मुझे ऑस्की पढ़ लेना है, उससे मेरे कुछ कुछ रैंडम पैसिव नॉलेज बनती रहेगी। ओके, एंड स्टार्ट कलेक्टिंग गुड केसेस फ्रॉम योर फर्स्ट ईयर। रेजिडेंसी इज द टाइम व्हेन यू कलेक्ट ऑल द गुड केसेस सो दैट यू कैन राइट पेपर्स इन योर थर्ड ईयर और ड्यूरिंग योर सीनियर रेजिडेंसी। It will be helpful. The case bank that you make during your residency will be helpful to you lifelong. So जो भी अच्छे cases होते हैं CT के, MRI के, X-ray के, start collecting those cases and keep a copy of them on your desktop, on your system. So tomorrow when you want to write some paper, you have cases with you, right? So this was about the first year. पहले समझना है कि क्या क्या चीजें हैं, फिजिक्स थोड़ा थोड़ा पढ़ना शुरू करना है, सिस्टम्स पढ़ना शुरू करना है, थीसिस प्रोटोकॉल को साथ साथ मैनेज करना है, और CT MR में कंसोल पे ड्यूटी है तो कंसोल का काम सिंसियरली करना है, राइट? Now we come to second year. So once you are transitioning to second year, what changes should come in your attitude? Once you have come to the second year, you should be more focused on the system. आपको system wise imaging pathologies अब ज्यादा seriously पढ़नी है, because first year में आपने passively कुछ सारे systems की pathologies देख ली होंगी, एक्सरे पे, अल्ट्रासाउंड पे, CT पे, MR पे, तो आपको basic understanding हो गई होगी। USG में नाउ ट्राई टू डू एडवांस USG केसेस, लेवल 2 करना शुरू कीजिए, फीटल इको अगर हो रहा है अच्छा करना शुरू कीजिए, USG गाइडेड प्रोसीजर्स करना शुरू कीजिए, और फिजिक्स में CT और MRI पढ़ना शुरू करना है, एंड ट्राई करना है कि सेकेंड ईयर में हम CT MRI फिजिक्स कंप्लीट कर लें। फिजिक्स को नहीं छोड़ना है, फिजिक्स को शुरू से ही पढ़ना है। इफ यू थिंक यू लीव इट फॉर योर थर्ड ईयर, it will not help, because you will have to again and again read physics multiple times so that during your exams you are able to remember and you are able to recapitulate and write in your exams about physics. वाइवा में भी physics बहुत पूछते हैं, and physics आपको latter life में भी काम आएगी। ऐसा नहीं है कि physics काम नहीं आती। When you open your own diagnostic center and you are deciding for different CT, MRI, ultrasound machines, this physics will help you, right? Then in CT and MRI, try reporting different cases कि अगर आज पैनक्रेटाइटिस रिपोर्ट किया है, कल को कोई एब्डोमिनल मास रिपोर्ट करना है, फिर कोई मेजेंट्रिक आया वो रिपोर्ट करना है। डोंट ट्राई कि पैनक्रेटाइटिस तो मुझे आ गया, जितने हैं आज के मैं वो कर देता हूँ, हेड ट्रॉमा आ गया है, हेड रिपोर्ट कर देता हूँ, हेड SOL। जितनी वैरायटी ऑफ केसेस रिपोर्ट करोगे, उतना ज्यादा पढ़ोगे, उतना ज्यादा सीखोगे। तो इजी पाथ नहीं चुनना है, मुश्किल पाथ चुनना है, फिर आपको बाद में सब कुछ इजी लगेगा, राइट? अगर अभी इजी चुन लोगे, बाद में सब कुछ मुश्किल लगेगा। सो इन सेकेंड ईयर बी कॉशियस दैट यू आर रिपोर्टिंग मल्टीपल टाइप ऑफ केसेस। अपने आप वाउचर करो कि मैं ये वाले केसेस जो हैं वो रिपोर्ट कर दूंगा। लिम्फोमा का आया है सर, मैं कर दूंगा रिपोर्ट, ठीक है, आई विल रीड एंड रिपोर्ट, यू कैन चेक माई रिपोर्ट, राइट? हेड एंड नेक, न्यूरो, GUT, ऑब्स, काइनी, अब जो सिस्टम में हमारा फर्स्ट में हमारे सिस्टम्स में बच गया था, अब उसके आगे यू हैव टू स्टार्ट रीडिंग, ओके? अपार्ट फ्रॉम दिस, your exam oriented preparation will start and will begin from second year. So now abhi tak aap first year mein you were reading, you were trying to acclimatize and you were trying to learn. In second year you have to start consolidating. So if you are reading some notes, you have, and you read some topic, start making small notes or start adding to your notes, make flowcharts and everything and start consolidating your materials कि जब आप थर्ड ईयर में अपना रिवीजन करेंगे तो आपके लिए कुछ टॉपिक्स के जो मटेरियल है वो तब तक तैयार हो गया हो. स्टार्ट कंसोलिडेटिंग योर थीसिस केसेस, कीप अ चेक कि मेरे केसेस हो गए हैं, फिर मुझे आगे स्टैटिस्टिक्स भी करना होगा, सो कीप अ चेक ऑन योर thesis. Then from when first year you were just passively revising the spotters and OSCE, in your second year make sure you revise some long and short cases. So हर इंस्टीट्यूट में सब वैरायटी ऑफ केसेस नहीं आती, कहीं पर pediatric spectrum ज्यादा है, कहीं पर pediatric spectrum बिल्कुल नहीं है. So when you revise miscellaneous short and long cases, you will be able to cover up all the spectrum which is not available at your institute. Okay, so फर्स्ट ईयर में स्पॉटर्स ऑस्की रिवाइज करते थे, सेकंड में साथ में हम थोड़ा सा लॉन्ग एंड शॉर्ट केसेस रिवाइज करेंगे. And second year is the time when you attend the maximum conferences. So first year में if you attend आपको समझ नहीं आता है and half day after the conference you want to go out and you want to party. But in second year you have some basic knowledge. So when you go to a conference and you listen to the lectures, you are able to understand and they will benefit you more. थर्ड ईयर में टाइम कम मिलेगा. थर्ड ईयर में बी वेरी चूजी कि किस कॉन्फ्रेंस पे जाना है, किस पे नहीं जाना है. सो इन सेकेंड ईयर यू कैन एक्सप्लोर एंड यू कैन अटेंड मल्टीपल कॉन्फ्रेंसेज एंड लर्न वॉट एवर इज बीइंग टॉट इन द कॉन्फ्रेंस. आपको समझ में आएगा, राइट? Then we shift to the third year. Now, third year is where the stress begins. So this is the year when you have to start preparing for your exams. You have to first complete your thesis and submit it. Thesis करके खत्म कर देना है, ठीक है? उसके बाद शुरू होता है हमारा एग्जाम का प्रिपरेशन. सो यू हैव टू रिवाइज, यू हैव टू स्टार्ट रिवाइज. तो फर्स्ट ईयर में थोड़ा सा पढ़ के समझा था, सेकेंड ईयर में थोड़ा नोट्स बना के कंसोलिडेट किया. नाउ यू हैव टू स्टार्ट रिवाइजिंग कि मैंने ये पढ़ लिया है पर अभी तो याद नहीं है. आई विल स्टार्ट रिवाइजिंग माई टॉपिक्स. जो भी टॉपिक्स छूट गए हैं, लाइक योर रीसेंट एडवांसेस, यू कवर्ड योर एक्सरे अल्ट्रासाउंड फिजिक्स, यू हैव कवर्ड योर सीटी एमआरआई फिजिक्स. The recent advances, if you have not read in the first 6 months of your third year, make sure you read all those topics. वो सब गंदे, बेकार, अनइंटरेस्टिंग और ऐसे टॉपिक्स होंगे जो आप कभी नहीं पढ़ना चाहते हैं, बट मेक श्योर कि आप इसको फर्स्ट 6 मंथ्स में थर्ड ईयर के कवर कर लें, क्योंकि एंड में तो बहुत स्ट्रेस और टेंशन होने वाला है. तो इसको फर्स्ट 6 मंथ्स में जो नहीं पढ़ा है उसको पढ़ लो. एक टॉपिक मुश्किल आप पढ़ लो, को पीजी को पढ़ा देना, एक मुश्किल वो पढ़ लेगा, वो आपको पढ़ा देगा, राइट? सो यू कैन डिवाइड अमंग्स योरसेल्फ, बट मेक श्योर कि हमारे ये रह गए हैं, अब इसको हम पढ़ के यार खत्म कर लेते हैं, राइट? Complete your physics. Whatever is left in your physics, complete it. Do your recent advances. Okay. Complete your thesis. Now is the time when you will be given independent reporting. So अब आपको इंडिपेंडेंट रिपोर्टिंग मिलेंगी. यू शुड बी फास्टर. आपने सेकेंड ईयर में स्ट्रक्चर रिपोर्टिंग करना, डिफरेंशियल्स बनाना सीख लिया है. अब आपने सब कुछ पढ़ लिया है, यू आर नॉलेजेबल. स्टार्ट डूइंग इंडिपेंडेंट रिपोर्टिंग. Okay, and if you have an intervention posting and you are interested, try doing basic non-vascular interventions so that in exam you have an idea, or go for the vascular posting. Observe how different vascular interventions are being done so that during your exam when they ask you about different interventions, because अब intervention बहुत पूछते हैं, तो आपको पता हो कि हाँ ऐसा ऐसा हो रहा है, depending on the spectrum which is available at your institute. Okay. थर्ड ईयर में कॉन्फ्रेंस सेकेंड ईयर में कर लेना है. थर्ड ईयर में आपको यू हैव टू विजिट द म्यूजियम. सो एवरी सिटी एंड एवरी इंस्टीट्यूट, मोस्ट ऑफ द इंस्टीट्यूट्स हैव देयर ओन म्यूजियम्स और देयर लाइब्रेरीज वेयर दे हैव अ कलेक्शन ऑफ ऑल द गुड केसेस, and the examiners will take out these good cases and take them for the exam. So if you have friends in other institutes and your HOD can give a word for you, go try and go and visiting different libraries so that जो spectrum आपने अपने पास देखा है और आपका मिस हो रहा है, when you go to other institute, see, oh, अच्छा यहाँ पे ऑब्जिन गाइनी का बहुत स्पेक्ट्रम है, MR भी दिख रहा है, प्लासेंटा इक्रीटा सब MR पे देख रहे हैं ये लोग. So try and cover the museums of other institutes in your third year and start developing confidence that tomorrow I have to do these things alone. कल मैं SR हूँगा अकेला ड्यूटी पे, कल मैं किसी डायग्नोस्टिक सेंटर पे काम कर रहा हूँगा, कल मैं किसी प्राइवेट हॉस्पिटल पे अकेले नाइट ड्यूटी कर रहा हूँगा. सो स्टार्ट गैदरिंग दैट कॉन्फिडेंस दैट टुमारो आई हैव टू स्टार्ट डूइंग थिंग्स alone. सो अकॉर्डिंग टू दैट आप अपना कॉन्फिडेंस बनाइए कि कल मुझे अकेला करना पड़ेगा तो क्या मैं कर पाऊंगा, राइट? सो दिस वॉज अबाउट द फर्स्ट सेकेंड एंड थर्ड ईयर की आइडियल सिचुएशन में हमें क्या क्या कर लेना चाहिए अपने तीनों साल में, सो दैट द रेजिडेंसी इज डिस्ट्रीब्यूटेड एंड देर इज नॉट स्ट्रेस इन द लास्ट 6 months ऑफ आर रेजिडेंसी। एंड स्टिल इतना सब करने के बाद भी आई टेल यू कि आपके पास पार्टी का टाइम होगा, यू नो। वी हैव डन all these things along with our residency, written so many notes during residency, and our residency was for 12 hours a day. And छुट्टी भी बहुत कम होता था, गवर्नमेंट हॉस्पिटल नहीं था, so all the government holidays which usually the MDs doing MD at a government institute get, वो नहीं था, but still we could party, we could make notes and we could study and do most of these things at our institute. तो पार्टी का टाइम मिल जाएगा, ठीक है। अब ये करना है तो बोल दिया, अब बात है कि ये करेंगे कैसे, है ना। करना है तो बहुत लोग बोल देते हैं, पर ये करेंगे कैसे, तो इसको कैसे करना है। सो द फर्स्ट एंड सेकेंड ईयर को एक रूटीन बनाना है अपना डेली का, कि 9 to 5 और 9 to 4 वॉट एवर इज माई टाइम इन द डिपार्टमेंट, आई विल ऑब्जर्व केसेस और आई विल परफॉर्म केसेस और आई विल रिपोर्ट केसेस एंड आई विल मेक अ लिस्ट ऑफ few important cases. If you are in ultrasound, you saw a liver abscess, you saw a anencephaly, you saw a PUJ obstruction. Just make a list. Okay, these 4 5 important cases I have seen. If you have time in your department, then try reading from your iPad about these things. Okay. और अगर वहां टाइम नहीं है तो लिस्ट बना के वंस यू आर होम देन मेक श्योर दैट यू रीड दीज 4 5 एंटिटीज फ्रॉम योर स्टैंडर्ड टेक्स्ट बुक, सो दैट यू नो कि हाँ अल्ट्रासाउंड पे लिवर एब्सेस है, मल्टीपल होता है, पायोजेनिक होता है, अमीबिक होता है, और सीटी पे क्या अपीयरेंस होता है, एमआर पे क्या दिखता है। यू विल गेट एन आइडिया कि हाँ ठीक है, समझ कम आएगा बट रीड, द मोर यू रीड एंड द मोर यू रिवाइज, मल्टीपल रीडिंग्स लगेंगी एक चीज को समझने में, बट रीड whatever 4 5 केसेस, ठीक है। अपना डिपार्टमेंट के 4 5 केसेस जो भी अच्छे देखे वो हमने पढ़ लिए, डिपार्टमेंट में टाइम मिला वहीं पढ़ लो, बहुत अच्छा है। नहीं टाइम मिला तो हमने घर में आके सबसे पहले अपने ये 4 5 केसेस पढ़ लिए उस दिन के। then is the time for your extra reading. So depending on your posting, if you're posted in ultrasound and it's just 9 to 4, you have more time in the evening, then give extra reading for 1 to 2 hours ऑन योर फिजिक्स एंड ऑन योर सिस्टम्स। जो हमने बोला कि फिजिक्स कवर करनी है और बाकी चीजें कवर करनी है फर्स्ट और सेकेंड ईयर में, तो वो 1 से 2 घंटा आप देंगे अपने उस चीज को पढ़ने के लिए। आपने केसेस पढ़ लिए 4 और आपने अपनी फिजिक्स या सिस्टम जो भी आपको टाइम मिला आपने थोड़ा सा वो पढ़ लिया। More reading can be done along with more parting in your ultrasound postings, and more reporting can be done during your CT MRI postings, right? And keep reading and keep updating the notes, which you are making your own notes or you are reading someone else's notes. Keep updating your notes and keep consolidating. Side थोड़ा थोड़ा consolidate भी करना है। फर्स्ट ईयर में रीडिंग करना है मैक्सिमम, सेकेंड ईयर में कंसोलिडेट भी करना है, ओके। एंड बिफोर स्लीपिंग गिव 15 to 20 minutes ऑफ रिविजन। तो हमने बोला था फर्स्ट ईयर में स्पॉटर्स और ऑस्की रात को 10 15 मिनट रिवाइज कर लेने हैं, एंड सेकेंड ईयर में कोई रेडियोलॉजी केसेस मिसलेनियस हमने रात को रिवाइज कर लेने हैं, ठीक है। सो हमारे 3 काम हो गए। डिपार्टमेंट में जो केसेस करे हैं हमने पूरे 2 साल डिपार्टमेंट में जो भी 3 4 5 नए केसेस देखे वो रिवाइज किए। हमने अपनी फिजिक्स वगैरह साथ साथ करते रहे, हम पार्टी करके आ गए और हमने थोड़े बहुत स्पॉटर्स वॉटर्स देख लिए। जिस दिन टाइम हुआ कर लिया, कभी टाइम नहीं भी है तो छोड़ दिया। जब हॉलीडे है तो ज्यादा पढ़ लिया, जब हॉलीडे नहीं है हेक्टिक था वर्क तो नहीं भी किया। सो इफ व्हेन यू हैव टाइम, अगर उस दिन ज्यादा कर लोगे तो यू विल मेक स्कोप जिस दिन टाइम नहीं होगा, राइट। सो दिस इज द रूटीन अ फर्स्ट और अ सेकेंड ईयर शुड फॉलो, राइट। Then what about the third year? So the first 6 months in your third year, just complete your thesis. Whenever you go for reporting, just choose the important cases कि लिम्फोमा एक रिपोर्ट करना है, हेड एसओएल करना है, नी एमआर में लेजन आया है वो रिपोर्ट करना है, लिवर एसओएल रिपोर्ट करना है। सो चूज एंड रिपोर्ट डिफरेंट केसेस। जितने ज्यादा अलग केसेस रिपोर्ट करोगे उतना कॉन्फिडेंट बनोगे अबाउट appearing in your exams, right? And do structure reporting, that you pick up different systems and you formulate the diagnosis, and then if possible you are coming to a final diagnosis, right? and then starts your structured revision of all the systems physics resembances. जो नहीं पढ़ा है वो हमने पढ़ लेना है, और जो पढ़ लिया था उसको हमने रिवाइज करना शुरू करना है, right? And this is for the first 6 months. In the last 6 months, it is again a very, very structured approach. You at least give 2 or 3 revisions to what all things you have already done. But one thing is very important, that do learning in a structured way. Okay, don't do कि मैं यहाँ से भी पढ़ लूँ और मैं इसका भी पढ़ लूँ और मैं ये वीडियो भी देख लूँ और मैं वो भी देख लूँ और वहां से भी पढ़ लूँ. If हमारे टाइम पे there were not many resources available, so we had a very tubular vision, and I feel lucky that we had that tubular vision. Now with so many resources available and with the different people telling you to read different things and different residents reading different, please don't go haywire and make your structured approach कि मेरे को ये पढ़ना है. These are the textbooks I have to follow. Then I am making my own notes or reading these things and adding and consolidating. And I will see a video on YouTube, or I will see any one good video to understand the concept. If I'm having that difficulty, that's it. एक ही चीज को 10 जगह से पढ़ते रहोगे तो फिर जो 10 चीजें आपको कवर करनी है उसमें मुश्किल होंगी. So don't get distracted with the lot of resources that are available. Try to consolidate your own resource, and that will be most helpful to you, right? Then is what are the mistakes to avoid. So क्या क्या करना है हमने देख लिया, कैसे कैसे करना है वो भी देख लिया, but what are the mistakes you need to avoid? First, most important is ignoring your radio physics. Please start your radio physics in your first year and keep doing it till your second year, and you should be done by completing your radio physics by the starting of the third year. उसे ignore नहीं करना है, third year के लिए नहीं छोड़ना है. Second is studying randomly. So please follow a structured approach. In first year, I understand you will read from multiple resources. You are gathering, you are acclimatizing. From second year, be more structured and consolidate the things you are reading. And avoid too many resources, right? And don't do passive reporting कि ठीक है ये GI liver SOL था, report पढ़ ली, हाँ ठीक है ऐसे होता है. नहीं, you have to report one liver SOL yourself. When you write the whole description of a lesion, then only you will be able to speak that. सिर्फ कि मैंने अच्छी अच्छी reports पढ़ ली, हाँ मुझे आता है, ऐसा नहीं होता. You make your own report and make your own differentials, and then the differential diagnosis, and then you come to a final diagnosis, right? Don't be afraid to ask question. Okay, you have your seniors. If you are finding doubt and you are thinking that why this SOL is labeled as hemangioma when you think that it should be something else, then do ask your senior ki ma'am, I was thinking that these are the findings and I was thinking why it couldn't be a hemangioma. So don't be afraid to ask questions. These are the 3 years. You are not in competition with anyone. You are in a learning phase. You can ask as many questions as possible. And the last is ignoring revisions. If you are just reading and reading and reading till your third year, it will not help. You have to pause. You have to revise the things which you have already read. So it will take you multiple revisions. So that is why consolidate your resources and then revise again and again from the compiled resource, and do a structured approach. Don't keep on reporting the same cases. Do different, try to report as many different cases as possible. Okay. Then what are the books to read, which, when, how? So we will take, this is again a very detailed topic, and I will be discussing in the next session that what are the books to read in radiology, which have to be read from end to end, where and when can you find out time to read these books, and which are the absolute necessary ones, which ones you can just select the topics and read. So we will discuss all this in our next session, right? So now how can RME, how is our platform going to help you? How can the new app we have launched, the notes we have structured, how we aim to help you? So the first is that by making this compiled theory resource, the new structured RME notes are point-wise theory notes, and they are printed with a lot of hand-drawn diagrams which can be drawn in your exams. So your effort of compiling your resource we have already done that for you. And all you need to do is read your standard textbooks and then add the extra points in your notes. So you can make your your own notes, which is the best thing possible. And if you want to use the RME notes, first read from your textbook, from different standard textbooks, and then add the extra points into your notes so that you are consolidating your materials. Second is we want to help build concepts for you. So that is why we have started with live classes. We are going to record teaching videos and put it into the app. The live classes will also be case discussions, like the last lecture we had, cystic pancreatic tumors. It was the case and all the good points about it. Then another case and all the good points. So all the classes, we are trying to have them on a case-based approach, right? Also, we will be uploading approach-based modules also onto the app so that it will help you build your concepts. What you have to do is go to your department, apply these concepts and report these cases, right? So हमने concepts building में help करा दी, but apply तो आपको ही करने हैं. So you have to go your departments. When you report your cases, you will be able to make the differentials and you will be able to reach a final diagnosis. Third is you want to revise the spotters, OSCE cases, and table viva. So we've compiled all that into the practical module. So for your exam preparation and the things you need to revise at a glance at night, we have compiled all that into the practical module, which is available on the app in the form of RME core. So the RME core is going to have all your spotters, OSCE cases, and table viva, which can be read at night easily. And the live classes and the teaching videos will be there, which will help you approach your cases and help you make a structured reporting format, right? So this is how we aim to help you. There is no hard and fast rule that you have to buy the notes, you have to take the app. All I want is that you should go in a structured way. You can take any resource which is available, right? There are so many resources available. You can choose any resources, but be structured. Don't try to grab all the resources and confuse yourself, right? And last, I would like to say that one size fits all nahi hota, because we all are in different circumstances. We are in different environments. So don't compare yourself from someone else. Where you are planted, try to bloom, try to learn there. जो missing है वो हो जाएगा, वो हम कर लेंगे. What will win is consistency from the first day, right? So be consistent in your efforts right from the first day, and they will be fruitful to you, and they will be 100% fruitful to you. So now you can share what are your difficulties during your residency. If you want to ask any questions regarding to difficulties you face during residency, you can ask those questions in the chat box. Okay. Most DNB hospitals do not provide fetal scan ANC exposure. I totally agree. I have done from Vedanta and there was no exposure. Even if there is posting, it is for very less time, duration like 1 month. So this is a very valid question. All the DNB institutes in corporate hospitals will have very less of fetal and ANC posting. The good point is that during your exams, these are asked. These are not much asked during a radiology residency exam. You might be asked some spotters, you might be asked some cases which you can still learn online, right? So exam purpose say you are quite safe because it does not affect you much. After you do your DNB from a corporate hospital, learn all the CT MRI they provide, and after your residency, do your SRship in a government hospital where there is a lot of exposure. So I did my DNB from Vedanta. I tried to learn all the CT MRI they wanted to teach me, and then I went to Lady Harding to learn the ANC. So I could do both the things, and I could pass my DNB also, learn the things also. And so whatever is missing in your residency, try to cover up in your senior residency. For diploma candidates specifically, please guide how to approach theory exam is 1.5 years at max. Physics, when to study systemized conferences. Okay, so for diplomas, the time period is just 2 years. I totally get it. So you need to, in the first 6 to 8 months, you need to accelerate all the things. जो आपके एग्जाम में पूछा जाएगा वो MD DNB से थोड़ा सा easy होता है. So you need to mark कि कितना पढ़ना है आपको, right? but you need to start your physics again. You need to cover your physics in the first 5.5, 1.5 years, because the last 6 months you just have to revise the things. तो आपको सब जल्दी करना है. Conferences also you can start attending after 6 months of your initial residency, right? Books to read, I will cover in a separate session, right? Uh, Private college with very few workload, how to approach? Okay, so private colleges, I understand the workload is very less. जो भी जितना भी है, try to learn from that institute. Then you can ask your consultants in private hospitals for a 1 month posting in a supportive hospital. So in Medanta, we got 1 month posting in Safdarjung Hospital, where we went and learned the ultrasound. So you can discuss this thing with your HOD, that sir, is it possible to post us for 1 month in some other hospital where we can learn the things which are missing in our institute. If they don't agree, then you will have to resort to online learning platforms where the things which are missing in your institute you can learn. You can be friends with people who are working in different institutes which have a good workload. So after 9 to 5, after attending your 9 to 5 hospital, you can go to these institutes to your friends, because शाम को after 5 the consultants won't be there in their hospital also. So go to your friends institute, work with them, report with them, and you will be able to see the spectrum. We used to have friends coming to us on Sundays to learn the things which were not available in their institute. That is how we managed. Then is, ma'am, please do these sessions for residents regarding books if someone wants to go via the FRCR route regarding it. So I am going to have a different session for the books. That is promised. The next session is going to what books to read, when to read. Can we buy the online practical module? The practical module has been incorporated into the RME core thing, because students had been asking, ki, we want classes, we want videos. So we have included everything on the app in the RME code. So you can take the module from there. What I heard from senior people, do give FRCR during residency. So giving FRCR during residency will depend how hectic your residency is, right? So agar if the residency is very hectic, then don't give it. Just learn whatever is there in your institute. Don't give it during your residency. Otherwise, you might make things tough for yourself. So hectic से toxic आप खुद बना लोगे, ठीक है? तो इसलिए अगर residency hectic है, तो try to learn from your residency and you can give FRCR after your residency. कहीं नहीं भागा जा रहा है FRCR. But in case your residency is very light, you have a lot of time, then try to give your FRCR during your residency. In 9, there are a lot of corporate hospitals which have less workload and who are offering DNB, and the students just go from 9 to 3 and then they are free the whole time. So then you can utilize your time in giving FRCR during your residency. But if the workload is good, try to learn in your department, because after this FRCR बाद में हो जाएगा, तो स्पेक्ट्रम आपका हॉस्पिटल ऑफर कर रहा है वो दोबारा नहीं मिलेगा. Very hectic first year, 12 hours a day. So first year we learned USG, but we were not able to read or how to cover up. Okay, so I totally get it. Our first year was also hectic. Our all the 3 years were 12 hours a day. And if you could not read in your first year, if when the duty is hectic, there is always scope to read on duty, right? So if you have your iPads, try to read on duty. If you have, it is compulsory to stay in the department for 12 hours. Try to read as much as possible on your duty. If you have not read, so I'm sure now juniors would have come. So you tell your juniors ki you manage work, we will read and we will teach you, right? So this is how things will go. आप पढ़िए, आप सीखिए, उनको पढ़ाइए, they will do the duties for you. We are having exams 1.5 years and then only 6 months are left. Would we even get time to study that standard, to leaving aside which ones to read? Yes, yes. Even in your diploma exams, you will be reading standard textbooks. Though, see, standard textbooks are many. Christensen is also a standard textbook. Fahars is also a standard textbook, and then you have higher physics books which are also standard textbook. It will depend. If you're doing diploma and standard of questions which will be asked is easier, then you can just restrict to the basic standard textbooks. FRCR, you cannot, FRCR, no, the norms for FRCR is changing day by day. The diploma candidates, I don't think they can give it. You need 3 years of training for that. So after your diploma, start with your secondary DNB and you can give your FRCR. You can clear the first step and the 2A earlier, and then you can give your 2B. What would be the right time to take any app subscription for residents joining? Most batchmates are taking it day one. Okay. So it will depend on you that what the app is offering or what benefits you want to take from the app. If you have a very hectic residency and you are learning a lot of things right there and you don't have the time to go online and learn from an app, then you can start from your second year. But in case your residency is not very hectic and you have a lot of time to read from some app, then you can take right from the first year so that you are utilizing your time. The best utilization is your department. If the department is not hectic, then you can switch to apps and online learn platforms. Don't waste your time. That is all I want to say, that don't waste your time. If you have time, then you can start taking from first year also. It will depend on where your residency is. Agar residency department sikha raha hai, that is the best. Specifically regarding, okay, the RME app, you will devise someone's job. So again, it is not about my app or someone else's app. It will again depend. If your residency is hectic and your department is teaching you, you are getting to see spotters or the good cases in your department only, and the best is to learn from your department and you can directly take it from the second year. In case your department work is not hectic and you are not getting the exposure to read and see everything, then you can resort to taking the app from the first year. So it is not about my app or some other. It is about how much time, how much useful the app will be to you. Would you be able to see one video daily? Would you be able to see some spotters OSCE daily? If the answer is yes, then take the app. If you think you won't be able to see, then why waste time in wasting your money in the app, right? What to do for physics? So what to do for physics? You have your textbooks, Christensen's, and then you have to learn about physics, and you can see a lot of online videos to see the application of physics. Is it good giving FRCR in the second year? So again, so it depends how your residency is. If your residency allows you extra time, there is free time to prepare for FRCR, then you can give it. If your residency is hectic, please concentrate and learn from your residency, from your department, and you can give your FRCRs later, right? Any more questions? Books, I promise you, we would be discussing in detail about different books in the next session, right? Any other questions? I hope I have not missed any question. Yeah, thank you. Okay. Yeah, yeah. Radiology will surely treat you very well. You just treat radiology well, and it is going to treat you very well. There is no second doubts. There is no other branch like radiology. You are in contact with all the clinicians, and you are in contact with everything in the body, right from head to toe. आपको medicine, surgery, pediatrics सब देखने को, सब सीखने को मिलेगा. So what could be better than that, right? Okay, so let's wrap up the session, and I will be. I will upload. Okay, sure. We will upload it on our YouTube channel, which is Radiology Medicine Notes, and then you can share it with your friends also. And we would be putting it in the app also, so that in case someone wants to read from the app later, they can do it that way also, right? And I would be seeing you for the next session, which is the which books to read during your radiology residency, and how you can find out time, how much to read, how much you can leave, which is most important, which is okay, and which can be left for latter reading. Okay? So thank you guys for being here, and it was lovely interacting with you all, and have a good time. Make the most of your time. These are 3 very crucial years, and they will pay you lifelong. So make the most of it. Okay, good night. Bye bye.